Now, the next thing we're going to discuss is cardiac arrest management. And in some ways, this is easy because we're simply following the American Heart Association guidelines for CPR. But there are a lot of operational considerations, and over the last decade, we've learned so much about what improves the chances of survival for a patient. Many of the things that have traditionally been done in ski patrols, it turns out, have really been to the detriment of the patient. And so we need to make sure that what we're doing is going to give the patient the best chance of survival. And the most important thing is that you have to focus on good CPR. And good CPR means doing CPR where the patient is. So we do CPR per the American Heart Association guidelines, regardless of the certifying organization or agency. We use the AHA guidelines. Airway management is needed. We call for the AED. So we've got the special equipment bag. The defibrillator is in that. We bring that to the patient. Patients are going to suffer cardiac arrest basically in two locations, in the lodge or outside of the lodge, and that's either on the mountain or in the parking lot or on the tubing hill. So, if the cardiac arrest happens in the lodge, we go directly to the patient, we start CPR. We are going to do a minimum of 10 minutes of CPR right there in the lodge before we do our first interruption and move the patient to the aid room. The mantra, the thought in your head, the belief you need to have and understand is that as soon as you move the patient, you almost completely eliminate their chance of survival. So the idea of scooping and running with them and getting them to the aid room, that 30 to 45 second delay in starting CPR, or that 30 to 45 second interruption in CPR if you did a couple of compressions and then said, let's get them to the aid room, that drops their chances of survival by about 50%. We don't want to do that. So, a minimum of 10 minutes of good resuscitation. CPR, bring the AED to the patient, defibrillate right there. If you get a pulse back, great, you move them immediately to the aid room. If you don't get a pulse back, 10 minutes, then get them to the aid room. Now, we're not going to be terminating cardiac arrest resuscitation ourselves, although we'll talk about a few cases where that might happen, but we're generally not going to do that. That's going to be a function of EMS. Now, the EMS protocols allow EMS providers to do that after 20 minutes of unsuccessful resuscitation. But we are not going to do that because we don't have the infrastructure in place to support what we do once we've terminated the resuscitation. So get them to the aid room, call for EMS, and we'll go from there. Now, if they arrest on the mountain, what do? Well, we get to the patient, we start CPR. We get the AED to the patient. We do 10 minutes of good, uninterrupted CPR. Compressions, ventilations, and if you don't have the bag valve mask with you immediately, that's fine. Do compression-only CPR until the bag valve mask device gets there. You need to do good CPR. 10 minutes. Do not stop in the first 10 minutes. Do not interrupt the CPR. Other people can be planning on how we're going to move the patient off the hill. If you can, give the patient every chance they have. Give them the full 20 minutes right there. Don't move them. If it's not possible, then we do CPR on the move. That's the two toboggans lashed together, a king airway in place to allow effective ventilation, and one person either kneeling over the patient or kneeling in the other stretcher and doing compressions. The ride down the hill is not a tuck and run. The ride down the hill is a controlled transport by the slowest, flattest, smoothest run possible. You may well need a second person in the toboggan holding on to the person who's doing CPR to stabilize them. They need to have good CPR. We are not doing 1, 2, 3 minutes of tuck and run interruption. If we do that, we have condemned the patient to no survival. Now, our CPR during the transport has the potential to be terrible and completely useless. I want you to focus on the fact that it is very, very hard to do good CPR while you're moving down the hill, and we'll try to practice that during the season. Set up a few scenarios to practice doing that, just so you can get a feel for how hard it is, both being in the horns and being in the sled and doing the compressions. So, good CPR. Really and truly, if you can be patient and do the full 20 minutes of resuscitation on the hill, at that point, the chances of survival are almost zero. Then you can load them, then transport them. At a minimum, 10 minutes of good, dedicated cardiac arrest resuscitation, including defibrillation, before you move the patient. Okay, you can go ahead now and complete the knowledge assessments associated with cardiac arrest.